My brother in high school actually had a sudden cardiac arrest. He's all okay now. Through that journey, we went through, a lot of genetic testing, and I had a lot of exposure to cardiology and to medicine. And I was just kind of fascinated about how the doctors navigated everything, working to find a diagnosis on such limited information. So ever since then, I couldn't think of anything else I'd be interested in doing. Their faculty is amazing. The people I work with in the kinesiology department, they're great with getting resources and opportunities to me. I was pretty heavily involved in the pre-medical club here, and through that I've gotten countless shadowing, volunteering, clinical hour experiences there, so that's been great. If there's one thing that I love most about the university, it's going to a class and hearing a lecture from a professor who really is passionate about what they're talking about, and you can absolutely tell the difference. And I think Iowa State chooses faculty that are great at that, and it makes me passionate about it just hearing about their drive in the field. I've been heavily involved in research ever since my freshman year here. It's a lot of participant-based research, and that's been amazing. Gaining those research skills and how to interact with patients, and that's ultimately strengthened my bedside manner, which has translated to my clinical experiences, so it's been great. We've come this far, but there's so much farther to go, and I think that's the kind of beautiful part about research and medicine. I think the biggest thing by far is the clinical experience, and you can get that even through volunteering. It just shows that it's so much more than the science-heavy parts. Obviously, that's very important, but you can be as smart as you want, but if you can't connect with someone, that's going to be a real hindrance for you as a physician. And I think a lot of people need to focus more on that aspect. I am kind of torn between family medicine. I'm really interested in rural medicine, but I also love cardiology. Whatever I end up doing, I think I'll definitely have a focus on cardio. My advice to someone who's deciding on that is to choose something you're really passionate about. That's going to help you in the long run. You're going to actually enjoy what you're doing whilst being around people and faculty that support you.